Okay, so let's start with anorexia nervosa, quick review, and then we're going to do it straight away. So just uh, like one thing that just to remember about anorexia nervosa, everything is low, apart from very few things, but everything in anorexia nervosa is low. And they have same symptoms like hypothyroidism, like they have constipations and they have, of course, weight loss, but like they have depression, they have they feel cold. So, but the blood pictures it's showing thyrotoxicosis, and this can be explained because so they don't eat, so they don't have energy in their blood. So the thyroxine is one of the hormones that make the people energetic. So that's why they have too much thyroxine in their bloods, and the pituitary compensating back by reducing the TSH. But otherwise, everything for them is low. And cortisol as well is high. So cortisol also make people running. So they give you energy as well. So because they lack energy, they have high cholesterol and the picture of thyrotoxicosis, but the symptoms of hypothyroidism. And like just for assessment, we need to think about first to make the diagnosis by having weight of 17.5 kilogram per meter square, or like they losing too much weight on weekly basis. Like this, one of the red flag is weight loss more than 1 kilogram per week. Even if the weight loss is more than 1 kilo per week, so this is really red flag, even if their weight now is not very bad. So they're going in very bad track as well. So we need to assess the weight loss in depth in this station, like how much weight she lost, and like when was the last time she measured her weight loss, and we need to just to see like how much kilos, how many kilos per week. So, and we need to assess like it is emergency. So we need to assess, for example, her dehydrations and all the symptoms. So you are in GB setting this station, so you need to assess the need for admission or not. So it depends on the severity of the anorexia nervosa. See if it is severe, so it's for admission, and severe it means like the weight BMI is less than 15 kilogram per meter squares, and rapid weight loss, and evidence of system failure. So require urgent referral to eating disorder, medical unit, or pediatric medical wards. So refeeding is considered under the medical. Oh, okay, so you don't need to worry that much because this thing is going to be done in the hospital, but you need to think about, is it severe or mild, and does it need immediate referral to the hospital or to the eating disorder, or is she fine? So this is things you need to assess in your history. So the thing that determines the severity is BMI less than 15, rapid weight loss, and evidence of systemic failure. So in the examination, we'll do head-to-head examination, we'll do all systemic review, and in the symptoms, you can do systemic review as well. Ask her about all the symptoms possible, including the endocrinology symptoms as well. Okay, so this is the most important thing to remember in the stations, and we, of course, we will touch on the psychosocial aspects and how this, like her thinking about the weight loss as well, and what influenced her. Is it the media, or like why she thinks she's fat despite the fact that she's very thin? So you need to elaborate these things in depth and see the psychological impact as well, anxiety and depression. And so let's do it and see how we can do it. Put it in a simple way. Practicing make it easy, I guess.